Now we'll talk about some of the strategies for achieving synchronization goals. Well, what we'd like to do is synchronize new wave emergence in all of the cows at the same time, so that cows have follicles at a similar stage of growth and development all at the same time. Now, one way of doing this is to actually go ahead and induce atresia or ovulation of any existing dominant follicles that occur. One way of inducing atresia or death of the follicles is to administer estrogen, and the common one that we use is estradiol benzoate, and we do that in the presence of progesterone, which we supply through a progesterone releasing intravaginal device, such as what's called a CEDAR or a Q-mate device. So what's happening here? We treat the cow with a CEDAR or a Q-mate that puts blood levels of progesterone high. We also give them an injection of estrogen, and so the combination of progesterone and estrogen has a negative feedback on GnRH secretion, reduces LH secretion, starves the growing and dominant follicles of luteinizing hormone, and so they die off. As they die off, we get an increase in FSH and a new wave develops. And if we can do that in every cow, then we'll have synchronized follicular wave emergence in cows. Now, the second way to do this is to actually induce ovulation. So if we inject, for example, GnRH into cows, if they have a dominant follicle that's got enough LH receptors, then that dominant follicle, even though they're in diestrus, or whether they're in estrus or diestrus, it wouldn't matter, it will induce that dominant follicle to ovulate. Now, we remember back from our physiology, if we induce that follicle to ovulate, this will result in a reduction in inhibin, and so we'll get a surge of FSH, and so we'll get a new wave emerging. So again, this is another strategy we can use to induce new wave emergence. We can inject GnRH, and that will ovulate any follicles that are mature enough to respond, and then we'll get a new wave emerging about 1 to 2 days later after we've treated them. Just a thought here to explain why we get a range in the pattern of onset of estrus in different cows if we don't control follicular wave emergence. So here we have, for example, 3 cows. We've got follicles coming up pretty much in a similar fashion and ovulating. If progesterone declines at this point here, this cow will come on heat first, this cow will come on heat second, this cow will come on heat third. We'll get a wide pattern in the onset of estrus and ovulation because they are at different stages of development when progesterone concentrations declined. Now compare that with 3 different cows who we synchronize new wave emergence in. We can see that in these cows, when progesterone declines, we have follicles that are at a similar stage of maturity at the same time, and so estrus and ovulation will occur over a much narrower window of time because the follicles were at a similar stage of maturity when progesterone declines. So our goal with our treatment, for example estrogen and progesterone or GnRH to force ovulate and cause a new wave emergence, is to cause all of our cows to start getting a new wave at the same time, so that when progesterone declines they'll enter estrus at a similar time. So just diagrammatically, when cows are treated with progesterone and estrogen at the same time, so the cows may have growing follicles on the ovary, then in the presence of progesterone and estrogen, that follicle will die off and a new wave will emerge and eventually ovulate when progesterone concentrations decline. What is the mechanism that causes this atresia and new wave emergence? Progesterone and estrogen decrease the gonadotrophic support for growing follicles, that is FSH and LH, because they inhibit the secretion of GnRH from the hypothalamus, and this causes atresia of growing and dominant follicles. When the dominant follicle becomes atretic, we get a surge of FSH, and so we get a new wave emerging, and so that's one way of synchronizing new wave emergence. The other way is to treat with something that will induce ovulation, and so we can inject gonadotrophin releasing hormone, which will induce an LH surge, or we can inject HCG, human chorionic gonadotrophin, which has LH-like activity, so it acts like luteinizing hormone. And so if we have a wave of follicles coming up, the follicle has enough LH receptors present. If we administer GnRH, we'll get an LH surge, and this will result in induction of ovulation. And so following induction of ovulation, a CL will form, a corpus luteum, and a new wave will emerge once this follicle stops producing inhibin. So what is the physiological mechanism here? Well, if we terminate the growth of the existing growing follicle by inducing them to ovulate or luteinize, we'll induce a rise in FSH, and that'll cause new wave emergence. So I don't expect you to remember dose rates and things, but here's just a bit of a summary. Treatments that are currently available to synchronize new wave emergence is GnRH, and again that's by ovulating existing growing or dominant follicles. If they don't happen to ovulate, they may luteinize, that is, they might still develop into a corpus luteum but physically not ovulate. Now for this to work, these follicles need to be mature enough, that is, they need to have an adequate number of LH receptors. Generally speaking, they need to be more than about 10 millimeters in diameter. Once you administer GnRH, you get an LH surge within a few hours, and they'll ovulate approximately a day or a little bit more after you give the GnRH. Now if follicles are less than 10 millimeters in diameter, they're not mature enough, then nothing will happen. You'll inject your GnRH, you'll get an LH surge, but the follicle won't ovulate, it won't become atretic, and so you won't synchronize new wave emergence in cows that have small immature follicles at the time of injecting GnRH. Estradiol benzoate in the presence of progesterone causes atresia of dominant follicles by reducing LH concentrations, and the interval to new wave emergence will occur about 4 days after you treat with estradiol benzoate. One problem with the use of estradiol benzoate is we can't use it in lactating dairy cows. Now we can use it in maiden heifers because they're not lactating, but we can't use it in lactating cows where that milk may be sold for export. Another form of estrogen which used to be available is called estradiol valerate. It also has the same effect of estradiol benzoate. It was a longer acting form of estrogen. It's no longer on the market, but it's another way of inducing new wave emergence in the presence of progesterone or aprogestogen. HCG, as we mentioned, will cause ovulation or luteinization of mature follicles over 10. Again, they've got to have adequate LH receptors. It pretty much acts like GnRH. Now experimentally, we've also used progesterone to cause atresia of dominant follicles by reducing LH secretion. If we treat with high concentrations of progesterone, then this will also reduce LH concentrations, and that will also result in atresia and new wave emergence. But it's not used commercially because progesterone concentrations need to remain high, generally for a few days, and there's no drugs currently available on the market that will make it high for a few days. If you want it high for a few days, you've got to inject it once a day, which is not practical. There are other treatments that have been used experimentally. Injection of porcine LH has been used to try to induce ovulation. Fluid that contains inhibin to decrease FSH concentrations has been used, and also you can stick a needle into the ovaries and suck out the follicles, and about 24 to 36 hours after you do that you'll get a new wave developing. But again, these aren't practical ways of doing it in commercial herds. Some of the doses that are used, I've just outlined these here. Generally doses for causing atresia in the presence of progesterone about 1 milligram per 500 kilos. Some advocate the higher doses up to 2 milligrams in heifers. Cows generally 2 milligrams, we don't usually go higher than that. GnRH depends on which brand you buy. Gonadorelin, which is a synthetic analogue of GnRH, we use about 100 micrograms, and buzarelin, which is a GnRH, another form of GnRH, we use about 8 micrograms. I've just got a note here which will become clearer towards the end of this series, is that if you're resynchronizing estrus, that is, you're trying to get cows that you've already inseminated to come back in heat if they're not pregnant, doses of estradiol benzoate should not exceed 1 milligram, because you can get a reduction in pregnancy rates. So, strategies for achieving synchronization goals. At the start of treatment, we want to synchronize new wave emergence, and we can do this by inducing atresia or ovulation, and the products we generally use are progesterone in combination with estradiol benzoate, or something that will induce ovulation such as GnRH or HCG. Our next strategy to achieve our synchronization goals is we want to induce a decline in concentrations of progesterone. That is, we want to make cows go from diestrus into pro-oestrus, because following pro-oestrus they can go into estrus. So we need to synchronize that, and the way we do that is by injecting prostaglandin F2 alpha to get rid of any corpora lutea that might be present. And then if we happen to be treating with progesterone or a progestogen, a progesterone-like hormone, we need to stop doing that and remove the source of progesterone or progestogen. So two strategies for doing that. Diagrammatically, we just need to reduce concentrations of progesterone to low levels, and this will allow for an increase in the release of GnRH, which will stimulate estrogen production by the follicle and induce the cows to come in heat. And we do this by injecting prostaglandin F2 alpha or removing an exogenous source of progesterone or progestogen. So there's the two strategies that we've looked at so far to trying to achieve our synchronization goals. Our third strategy is during the synchronized follicular phase. That's once progesterone comes down to basal levels, sometimes we can tighten up the pattern of onset of estrus and ovulation by synchronizing ovulation, and the way we do that is synchronize a pre-ovulatory LH surge to induce ovulation. This is not always done, but it's done quite commonly, and it's used if we just want to tighten up the pattern of onset of estrus and ovulation a little bit more. How can we induce an LH surge? Well, during pro-oestrus, the way that cows normally induce their own LH surge is that concentrations of estrogen rise, and that has a positive feedback effect on the hypothalamus, and that induces a surge release of GnRH, which induces a surge release of luteinizing hormone. So we can mimic that by, when concentrations of progesterone are low, we can simply administer estrogen in the absence of progesterone, and this will induce an LH surge. Alternatively, we can administer gonadotrophin releasing hormone, and this will induce an LH surge. Another method which is used to tighten up the synchrony of estrus a little bit, not a lot, doesn't do it a lot, is we can administer equine chorionic gonadotrophin, which has some FSH and some LH effects, mainly FSH type effects. So this tends to stimulate follicular development, which in turn can stimulate the production of estradiol and again tighten up the pattern of onset of estrus and ovulation a little bit. And we use doses between about 350 to 600 units. Because ECG acts like FSH in the cow, if we give too much ECG, we can actually super-ovulate the cows, which we don't want to do because we don't want to get twins or too many twins. So it's important that you don't exceed these doses, otherwise you will increase your twinning rate. So the two main methods for synchronizing pro-oestrus, that is an LH surge, are to administer estrogen in a low progesterone environment and to administer GnRH. If we want to tighten things up a little bit more and facilitate ovulation in cows that perhaps may be more reluctant to ovulate, for example, if you're treating anestrus cows, then often we'll put some ECG into the system as well, to just increase the chances that we'll get a higher ovulation rate. So why do we synchronize ovulation during synchronized pro-oestrus? This is again just going over what I've just said. The aim is to improve the synchrony of ovulation, to increase the probability that ovulation will occur in animals that are at risk of not ovulating, that is anestrus cows or prepubertal heifers. These animals, if you synchronize them and just let them go into pro-oestrus, then some of them won't go on to ovulate. They'll actually shut down again. So to give them an extra incentive, an extra stimulus to ovulate, we can induce ovulation again by injecting estradiol, benzoate, or GnRH, and maybe even putting some ECG into them as well. By inducing ovulation in this manner, we can usually inseminate at a fixed time. That is, the day after you induce ovulation, usually you can go ahead and inseminate. Some people do it on the day of ovulation, on the day of treatment, to save some labour in terms of getting the cows in the yard. But ideally, it's best to administer these treatments the day before and then inseminate the following day. But this varies a little bit with the protocols that you read about, and you'll see some where it's done at the same time as artificial insemination. So again, graphically, we've got cows at slightly different stages of follicular development. Estrus and ovulation occurs earlier in cows with more mature follicles. We've learnt that previously, and this results in a wide pattern of onset of estrus and ovulation in these animals. Now, if we've got cows with slightly different maturities of follicles when progesterone comes down, then we can tighten up the pattern of onset of estrus. Rather than have it a little bit wide here, these might be separated by 2 or 3 days, we can have them all ovulate but pretty much within 24 hours of each other, and that is by inducing ovulation, and then usually after we've induced ovulation with estradiol or GnRH, we'll inseminate them, so that when this egg pops out, which is about approximately 24 hours after an LH surge, then the sperm are already there, so hopefully we'll get a high fertilization rates. So cows 2 and 3 with an induction of ovulation treatment will ovulate a little bit earlier than what they would have if they'd just been left to ovulate under their own steam. So we've looked at a number of strategies for trying to achieve our synchronization goals, and the last strategy we looked at was synchronizing the follicular phase and synchronizing a pre-ovulatory LH surge to induce ovulation. The other thing that we want to do is we want to try to ovulate an oocyte with optimum fertility. Different synchronization treatments sometimes can affect the fertility of the oocyte, so we want to optimize the fertility if possible. So one thing that we need to do is restrict what we call the duration of dominance of the dominant follicle to about 4 days by limiting the length of treatment with progesterone. If cows are treated with an intravaginal progesterone releasing device that releases progesterone, and their corpus luteum is not present or it dies during the treatment process, then they'll have what's called an intermediate concentration of progesterone circulating in their system. This will result in the LH frequency of release from the anterior pituitary gland will be slightly greater than it would be during a normal diestrus. And this is because progesterone concentrations are just a little bit lower than what they would be during a normal diestrus. This means that if we treat with progesterone for too long, the dominant follicle, instead of undergoing atresia, it persists on the follicle for a bit longer, for a longer period of time, and this can result in what's called the presence of a persistent dominant follicle and an aged oocyte, and this can result in a reduction in fertility. So one way we try to prevent this is we restrict our treatment with progesterone to generally 7 or 8 days. For example, if we were to treat with progesterone for 2 weeks, then eventually the corpus luteum will die and the dominant follicle will persist on the ovary for longer and fertility will decline. We'll get a good synchrony of estrus because we've got follicles, a lot of cows with large follicles on them, but when that follicle ovulates, fertility will be reduced. So the main message there is when we're treating with progesterone, don't treat for too long, keep it around about 7 or 8 days approximately, don't go for too long, so don't treat them for a couple of weeks. Otherwise you'll get a persistent dominant follicle, and that will reduce fertility. The other thing we were looking at, I wanted to look at, was to optimize concentrations of progesterone following ovulation. In order to do this, we need to ensure that we're not trying to ovulate during pro-oestrus follicles that are immature. If they're too small, then they either won't ovulate, or the corpus luteum that they produce will be too small and it won't produce an adequate amount of progesterone. Now, the way to ensure that we've got a follicle of sufficient size or maturity is, again, when we're treating with for example, a progesterone releasing device. If we inject estradiol benzoate or GnRH, then we get new wave emergence coming up. We allow enough time for that follicle to get big enough before we try to induce it to ovulate. And it sort of suits our purposes that a treatment interval of about 7 or 8 days is usually good enough to do this. I should add that you will see there is some experimental evidence as well that if you administer ECG at the time of removing your CEDA or your Q-Mate device, that you can, in some cows, improve the amount of progesterone that's produced following ovulation. So particularly cows that are in poor body condition, that are not cycling at the time of treatment, administering ECG, as well as facilitating the synchrony of oestrus, also can result in better production of progesterone following ovulation. Now, these are all the goals that we want to do, but not every protocol will achieve all of these goals 100% of the time. Again, this is just revising the point that if you try to force ovulate a follicle that is not quite mature enough, that is at the time of pro-oestrus, then that follicle may not ovulate, or it may produce a CL with that produces a low concentration of progesterone. Whereas a cow with a follicle that's mature enough, it will ovulate and produce a corpus luteum that produces a normal amount of progesterone. Again, if you've got follicles of different size and you think, oh well, I'll just treat them for longer with a progesterone intravaginal device for example a couple of weeks, and this will allow this follicle to catch up in size to this one, then you might end up with a persistent dominant follicle and an old oocyte, so that when progesterone comes down, this old oocyte can be fertilized by sperm, but it doesn't survive as well as a follicle that grew and developed normally and didn't hang on around on the ovary for too long. So when we're trying to force ovulate follicles, if they're too immature, this is not good. It can result in a reduction in fertility, because some of these follicles won't ovulate, or they'll produce a corpus luteum within it that produces an inadequate concentration of progesterone. On the other side, if the follicles are too old, if they're too large, too old, then that can also reduce fertility, because our oocyte is too old and we'll get an increase in early embryonic loss. Again, this is just illustrating treatments that are being used to increase the chance that ovulation will occur following, if we want to induce ovulation. Generally we're going to use GnRH or estradiol benzoate, and sometimes we'll also use some ECG to encourage the cows to ovulate, but also produce more progesterone following ovulation. Estradiol benzoate has the advantage that it's cheaper than GnRH, but it can't be used in lactating dairy cows. Again, some of the dose rates that can be used, and again some of the strategies for achieving our synchronisation goals. So at the start of treatment we need to synchronise new wave emergence, and we can do this with GnRH or estradiol benzoate in the presence of progesterone. At the end of treatment we need to synchronise the decline in progesterone, and we can use prostaglandin F2 alpha for that, or we can remove the device that's providing progesterone to the cow. During the synchronized follicular phase, we can synchronize a pre-ovulatory LH surge to induce ovulation by administering again GnRH or HCG or oestradiol benzoate during pro-oestrus. We also want to ovulate an oocyte of optimum fertility, so an oocyte that's not too old and not too young. And we also want to ensure that concentrations of progesterone following ovulation are adequate. So here's just some review questions for you to consider for this section. What hormone would I use to induce luteolysis in cows and heifers? Which exogenously used hormones are used to synchronize new wave emergence, and what are the mechanisms of action? And for what purpose might ECG be used in a protocol to synchronize estrus? And what is the disadvantage of trying to induce immature follicles to ovulate? So just have a think about these for a moment, and then we'll see if we can answer some of them. Okay, so let's have a think about some of these questions. What hormone do I use to induce luteolysis in cows and heifers? Well, prostaglandin F2 alpha, or a synthetic analog such as, we haven't mentioned it so far, but something like cloprostenol. Which hormones do we use to synchronize new wave emergence, and what is the mechanisms of action? Well, generally we use estradiol benzoate in the presence of progesterone, and the mechanism of action is that this has a negative feedback effect on the secretion of GnRH. We get a reduction in LH and FSH secretion. In particular, the growing follicles get starved of gonadotrophic support such as FSH and LH, and so we induce atresia in the growing and dominant follicles. This results in a reduction in inhibin concentrations. We then get less inhibition of release of FSH from the pituitary gland, and so we get a little surge of FSH, and this results in new wave emergence. Alternatively, we can inject GnRH, gonadotrophin releasing hormone, and this will induce an LH surge. So if we have a follicle that's mature enough, has enough LH receptors, it will ovulate, and once it becomes luteinized, or once that LH surge occurs, then the production of inhibin by that follicle will also decrease, and so we'll get a little increase in FSH again, and that will stimulate new wave emergence. Why might we use ECG in a protocol to synchronize estrus? In animals that are at risk of not ovulating, particularly animals that are anestrus or in poor body condition, prepubertal animals that are more likely not to ovulate, we can increase the probability that these cows will ovulate by giving them an extra stimulus with ECG, which has quite a few mainly FSH-like effects and a little bit of an LH-like effect. The other reason is that in those cows that are at risk of not ovulating, they're also at risk of, if they do ovulate, not producing enough progesterone following ovulation, and the ECG does seem to boost progesterone production in these cows. Now, in a normally cycling cow, a cow in good body condition, ECG may not make any difference at all, so we tend to use it more in cows that are a bit marginal in body condition or at greater risk of not cycling. What's the disadvantage of trying to induce immature follicles to ovulate? Well, if we try to do that, these follicles may not ovulate, and so we won't get a pregnancy, or if they do ovulate, the corpus luteum that they produce following ovulation may secrete less progesterone than what we would normally expect. So this concludes this section. It's been pretty heavy going, but we'll get onto some protocols soon, and hopefully you can begin to apply some of the theory that we've been talking about so far.